By 50, half of men have an enlarged prostate, and by 80, it's nearly all of us. So if you haven't already noticed a slower flow or those annoying toilet trips haven't happened yet, it's probably only a matter of time because your prostate is growing right now. And when these symptoms happen, prostate cancer will cross your mind. But usually, that's not the case. This is more a matter of biology. And once you know how and why things happen, then the fixes start to make sense. I'm a GP, I see this all the time. So by the end of the video, let's make sure you know how and why your prostate is growing and what you can do about it. And then I'll just completely flip it on its head because it might all be completely wrong. Let's start at the start because most men don't know much about their prostate at all. And to be honest with you, there's not that much to know anyway. It's a walnut-sized gland under the bladder, and its only real job is to make fluid for sperm to swim in. That's it. But the easiest way that I think to see how the prostate works and why it does what it does and connecting BPH with prostate cancer, and bear with me, is to think of the prostate like a tree. Our tree needs rain to grow and function, and that's testosterone. But here's the confusing things. Testosterone levels naturally drop as men get older by about 1% per year. So you'd think the prostate would shrink as you get older, but in fact, it actually gets larger. So why is that? It's because there's a type of fertilizer in the soil called dihydrotestosterone, or DHT. This is a more potent version of testosterone that still drives growth, even when the rain has stopped pouring. You'd think there must be some sort of evolutionary purpose or advantage to getting our prostates bigger and bigger, but the answer is no. You see, evolution didn't expect us to live this long, so the priority was get the prostate up and big and that tree functioning as quickly as possible, and after that, so what? But when it comes to the prostate, bigger isn't always better. So if you get waterwork trouble, actually no, scratch that. When you get waterwork trouble, prostate cancer is naturally going to cross your mind, and it makes sense because look at these two definitions I made up. So BPH is basically where the prostate cells grow and multiply in an uncontrolled way. And then you've got prostate cancer, which is where the prostate cells grow and multiply in an uncontrolled way. So what's the actual difference here? Well, back to the tree. Trees don't just grow upwards, they also grow downwards. Like in BPH, these roots predictably stay close, they wrap tightly around adjacent pipes, narrowing them and restricting the flow of water. But in cancer, the roots themselves are different and unpredictable, and at the start, they may grow sideways without even touching the pipes. And that's why prostate cancer often doesn't give any symptoms at the start because it's nowhere near the pipes, whereas BPH definitely does. And the good news is BPH is significantly more common than cancer. Your lifetime risk for developing prostate cancer is about 13%, but for BPH, it's more like 80%. That being said, it can be very difficult to tell the difference between the two conditions. So one of the takeaways today is if you're having symptoms, you've got to go see your healthcare professional. Okay, let's ditch the tree and see how do you know if you have it. In BPH, the prostate basically narrows the urethra, making it harder to empty the bladder. So you get symptoms like difficulty starting your wee, a weak flow, stopping and starting midstream, getting up at night multiple times, and that annoying feeling of never fully emptying. Still, as doctors, we don't assume, and that's where the rectal exam comes in, where we can feel the prostate. Smooth, rubbery, enlarged, we know that's BPH. Craggy, firm and enlarged, now that could be prostate cancer. And there's blood tests like PSA can also guide us, though they're not perfect. So, is that it? It's just part of life? Or is there anything you can do about it? First, the simple things, lifestyle changes. Cut down on fluids before bed, especially alcohol and caffeine, which irritate the bladder, and try double voiding. Finish, wait a moment, then try again. And if you're still struggling to get those last few drops out, you can try massaging the area between the scrotum and the back passage, which can just squeeze the last few drops out and fully empty the bladder. There are other techniques as well, which I'll label and link below in the description for you to have a look at. Now, sometimes these changes on their own can make enough of a difference to change someone's life. But if not, we can look at tablets. The first group is alpha blockers, and Tamsulosin is the most popular one because it's the most prostate specific. By that I mean there are ones called doxazosin, alfazosin and others, but they tend to have quite the effect on a blood pressure as well. Now that could be two birds, one stone. If you have high blood pressure, it helps reduce it, but they all work in a similar way, and that's by loosening the prostate's grip, allowing the urine to flow a little freer. And these tablets work within days to weeks, so give them up to 6 weeks to see if they work. They do have downsides though, because they can cause dizziness, lightheadedness, especially if you stand up quickly, tiredness, and occasional retrograde ejaculation. And this is where semen goes backwards into the bladder instead of outwards. This doesn't damage you, it can just be a little disconcerting. So the next group of drugs, called 5-alpha reductase inhibitors like finasteride and dutasteride, work in a different way to the alpha blockers. They lower levels of DHT. That's the fertilizer that's in the ground that keeps the tree growing. So by lowering those levels, you prevent future growth and even lead to shrinking of the prostate. But these ones can take a lot longer to take effect, so we're talking several months, and they do come with some side effects. Reduced libido, weaker erections, it might lower your mood, and it might cause breast swelling or tenderness. And then of course there's the option to combine the two, weaken the prostate's grip and shrink it. And if medicines don't work, it might be time to unblock things directly. The classic one is a TURP, and this is basically shaving out the prostate tissue, which widens the passage for urine to go through. And then there are newer laser techniques too, which do a very similar job, just less bleeding and quicker recovery. Newer options include UroLift implants, which pin the prostate lobes back like the curtains on a rail, keeping the channel open without cutting tissue. And then there's Rezum therapy, which uses bursts of steam to damage the prostate tissue, leading to it getting smaller over time. And for very large prostates, surgeons might do an open or robotic simple prostatectomy, and this is where they remove the central part of the gland. Unfortunately, side effects can include incontinence, bleeding, problems with ejaculation, but most men actually do very well. Okay, you've gotten this far, but what if I was to say to you, it's all wrong, or it could be all wrong? Maybe it's not your prostate at all. Maybe the problem is somewhere else. I know it sounds crazy, but this problem actually happens more often than you think. You see, there's a trap. If you go to the doctor about waterwork issues because you're a man, the first assumption is it must be your prostate. But often the guilty party is actually your bladder, believe it or not. You see, the bladder is a bag of muscles, and if those muscles go twitch, 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 then that can translate as urgency. So if you're the sort of man who gets the feeling of you got to go to the toilet quickly, and if you don't go now you might have an accident, then that's more likely to be your bladder than your prostate. Now the thing is, they actually both coexist together very frequently, and we've spoken today about BPH, but if you want to learn about the bladder side of things, something that's very common and forgotten about, have a look at this video that I made here. But I hope today has been useful. Hopefully you know a little bit more about BPH now and feel a bit more confident about it. Thank you very much for watching, and hopefully I'll see you over there.